Hi, I'm Habib Olajide. Today we have the pleasure of interviewing Dr. David Jaspan. He's the chair of Obstetrics and Gynecology here at Einstein Healthcare Network. What are some challenges today in the area of obstetrics?
There's multiple challenges in obstetrics. Our biggest challenge at this point is helping women prevent preterm delivery. It's helping women initiate prenatal care early in their gestational age, in their pregnancy.
Okay.
And it's helping women to be educated about what they can do to enhance their own health care, not only for themselves, but for their child.
Okay. In some communities, we're seeing a shortage of obstetricians. Would you say this is due to insurance coverage or malpractice?
So it's a great question. In the Philadelphia area, I'm not sure there's a shortage of obstetricians. There's certainly a decrease in the opportunities and locations for women to have their baby. Several years ago in the Philadelphia area, there were 17 additional hospitals that were providing obstetrical care.
Okay.
Now in the city of Philadelphia, unfortunately for women, there's only 6 hospitals that enable patients to present for delivery. Each of those hospitals has a residency program, and each of those hospitals has a mission to provide service to the community that they serve. So the opportunities for access to obstetrical care in the city of Philadelphia have been significantly limited. And you're right, it really is due to reimbursement and malpractice.
And is there anything happening for us to change that?
Unfortunately, no. There's nothing happening to change that. The hospitals that have closed their obstetrical units, I'm afraid will never reopen them again.
The birthing process now is much more easier for women, and it's a smoother transition for women. What have hospitals have been doing to make it more meaningful and less painful for mothers and their partners?
So I would never say that delivering a baby is easy. But what I would say is we've done many things through medical care and social issues to help women have better access to different things, such as epidurals are more readily available for patients to ease their pain during labor. Doulas are women or other individuals who are present with the mother and the family during their entire labor course, and they provide education, counseling, and support to enable the patient to have an easier transition through. Additionally, midwives and providers at the bedside, enabling patients to have the support and education that they need, has made the process a bit better. Here at Einstein, we have several grants for something called Centering Pregnancy. Centering Pregnancy enables patients to have group prenatal care surrounded by peers. And so these are women who are grouped together by when their due date is to occur. And that enables them to share the experience throughout with a single provider providing them education, support, and then support for their baby when the baby's born. And what we know about the centering model, is that patients like it, patients show up more frequently, patients get great education, and they have a better birth experience.
Okay, so you're seeing an overall better support network for mothers.
Exactly right.
Okay. And for our viewership who might not understand the whole ordeal of pregnancy, could you explain the birthing process from when a mother actually enters into labor?
Sure. So the birthing process involves contractions, which are from the uterus, to cause the cervix, the lower part of the uterus, to dilate, which are painful. By definition, labor is painful. However, as we just discussed, an epidural or mindfulness can enable patients to reach a better place so they're more comfortable. And the contractions will continue, enabling the patient to reach 10 centimeters of dilation of the cervix.
Okay.
At 10 centimeters, that's when the pushing begins. And a woman can push for 3 or more hours until she delivers the baby. At Einstein, over 70% of patients will deliver vaginally. Okay. Nationally, unfortunately, the number is less. The national average for cesarean section rises very close to 33%. At Einstein, because we have providers on the labor floor all the time, we have exceptional nurses, we have great midwives, and we have the centering program, and we have anesthesia here all the time, our C-section rate for many of those reasons is much lower than a national average.
Okay. Do you guys ever have problems with turning the baby?
So if the baby is not head first, there are opportunities that we have if the patient agrees to have the procedure. It's called an external, so from the outside of the abdomen, version, external cephalic version, creating the baby whose head is in the upper abdomen, making the baby do a flip to put the baby's head in the pelvis. The success rate is different for different patients, but certainly it's an option for many patients. There are certainly contraindications and indications, and that's all reviewed with the patient, her provider, and our high-risk specialist.
Okay. And obviously prenatal care is important for a mother going into pregnancy. What are some guidelines that you would say a woman entering pregnancy should follow?
Certainly. So we would love to have all the women who are pregnant, as soon as they have a positive pregnancy test, initiate care with an obstetrical provider. That would be optimal. Why is that optimal? Optimal because we can make changes to perhaps certain medications. Even better would be this. Women who are thinking about being pregnant, even considering it, should be seen by an obstetrician beforehand. Why? Because they might be on some medication which could be harmful to an early pregnancy. There are all host of medications. There are blood pressure medications, asthma medications, seizure medications, and multiple others that are actually harmful in the first trimester. So if a patient can present when she's considering pregnancy, that would be best. However, if she doesn't, and it's okay, then we will see her as soon as she knows that she's pregnant, and we can initiate care then. The sooner that we can see someone, the more opportunity we have to provide a teamwork approach to her care.
And are there any supplements especially that they should take? I've heard folic acid is one.
Excellent research you've done. So certainly, you didn't say prenatal vitamins. Prenatal vitamins actually, them in themselves have not been shown to do anything to enhance the pregnancy. It's exactly as you said, it's the folic acid. Okay. So folic acid really should be taken before you conceive, preferably 3 months before you conceive, to have adequate levels in your body. Many of you may notice on your loaf of bread it's fortified with folic acid, and that's the reason. It decreases something called spina bifida, which is abnormal development of the spine and the skin that overlies the spine.
In terms of working women entering the workforce, is there maybe an age that they shouldn't become pregnant at?
So that's an individual patient's decision to make. However, we know that over the age of 35, there are increased risk of being pregnant. Many women now are pregnant over the age of 35, and it certainly does not mean if you are over 35 you will have a problem. It just statistically increases your risk. However, we also know that many women have put off childbearing because they had careers or currently have careers, they're in school, or whatever their own personal decisions might be. So I never want to say that there's a range that I would tell a woman not to be pregnant. It would just be what we talked about before, the counseling that we could provide her about the risk for her as an individual and her family would be great if we could see that patient while she was considering the option rather than when she was already pregnant.
Could you tell us about some advancements that are happening here at Einstein Healthcare Network?
Sure. So, as we mentioned, the centering program, we're also in the final steps of becoming a baby-friendly hospital. What does that mean? That means that the baby stays with the parents for 23 of 24 hours a day. It means that when the baby's born, we have immediate skin-to-skin contact with the mom and the dad if he so desires. It means that we're trying to enhance the breastfeeding opportunities for our patients. Breastfeeding is one of the most underutilized resources in this country. There's Healthy Patient 2020, which is trying to achieve better breastfeeding outcomes for our patients. Breastfeeding has been shown in the medical literature to decrease the risk of breast cancer for the mother, decrease the risk of ovarian cancer. For the baby, it decreases the risk of respiratory infections, ear infections, and asthma. So we really try through this process of baby-friendly to make this knowledge available to our patients and their families to enhance breastfeeding. Additionally, we have just completed, we will be just completing renovations in our entire postpartum floor, so where women go after they deliver. The rooms have been completely renovated. They are single rooms only for the patient and her family. We even took the thoughts from our pediatric colleagues to put specific types of lights inside the room so that the pediatric team can do their examination of the patient in the room with the family. That's important because it helps the family understand what's going on with the baby, and they increases their compliance for their follow-up. So we've done many things here at Einstein to enhance the labor process and to make it a smoother transition for the patient and then her newborn.
Could you tell me more about the Pride Clinic?
Certainly. The Pride Clinic here at Einstein is run in our Department of Obstetrics and Gynecology in our Klein building on the 4th floor. It started in June of 2015. It was brought to my attention by one of my residents, Michelle Stile, and one of our physician's assistants, Sharon Butterworth. They made it clear to me that the members of the LGBT community, they have a don't feel safe when they access health care. The mission of Einstein is to provide health care and education for all we can reach. And we are clearly not reaching this community. Any woman should go to the gynecologist when she has a problem. The interesting thing that people may have heard about is that when the need for a pap smear, the interval now has been extended. The pap smear is one small component of gynecological care. The pap smear is designed for one thing, and that's to check for cervical cytological abnormalities, abnormal cells of the cervix. That is not the same as going for gynecological care. For contraceptive care, for well women visits, for a whole host of reasons, women should be seen, no matter what age, they should be seen annually by their obstetrician gynecologist. We did significant amount of training. We did significant amount of changes to our forms, our paperwork, to make the forms and paperwork and our staff well educated and to be able to meet the needs of the community. We have to date seen 27 patients in our Pride Center. All these patients, all of them, had either never been seen by a gynecologist or not been seen in the last 10 years. So there's a real need in the community, and we're really thrilled to be able to meet that need.
Thank you for being here with us today.